Hey everybody, Dr. Mike here with Premier Chiropractic. I wanted to share something with you that's really important to me and my philosophy when it comes to chiropractic care, health, and actually, quite frankly, the research behind chiropractic and the way the body works, so on and so forth. And what that is actually providing people with recommendations. All right, so many times people are surprised when they think of a chiropractor recommending X amount of visits and X amount of times a week for so long. And because unfortunately we have the idea that I just want to go when I want to go. And if I feel well, why would I need to keep coming? All right. And we take a lot of time to educate people because we want you to have a clear understanding of your body and the way it works. The problems that we find in people's health, and especially in their spinal system and nerve system, is what we call a subluxation, okay? Again, that can take place over years and years of wear and tear, just like it can happen to the arteries of your heart. Do you feel it? Often you don't feel it. Same thing in the spine, okay? When the spine is subluxated, it will progressively deteriorate in rot, essentially, just like your teeth rot when they are not cared for. Okay, so when somebody comes into our office, we do a full evaluation from A to Z. We sit down, we cover somebody's health history from top to bottom. We really figure out your goals for care. And in addition to that, we have state-of-the-art technology where we can actually do a functional exam on your neuromuscular system, again, allowing us to give you the most accurate and best care possible. In addition to that, oftentimes we'll do digital postural x-ray. So again, we are not just taking a guess. We're not basing your health and your care off of how you feel. We have the facts, the proof, and the science right in front of us so we can give you recommendations, okay? The recommendations we give people are to get you feeling well, but most importantly, stop the problem, which is often the cause of your symptoms, whether you have them or not. Stop the problem, get it stable again, and ultimately keep it maintained and keep it healthy. Just like you're gonna brush your teeth, not just when they hurt. We wanna take care of them for how long? For the rest of your fill in the blank, the rest of your life. Just like you want to do that, we want to keep your spine and nerve system as healthy as possible also for the rest of your life. It's the only one we ever get. And the comparison is, I've had people come in and, maybe they don't want to follow a recommendation. They just want to kind of come in when they hurt. Hey, that's better than nothing. It's your choice. But that's kind of like going to a personal trainer and saying you want to get in great shape. And the personal trainer just says, well, sure. Hey, Dr. Mike, that's awesome. Here, you can just come into the gym whenever you want. Just do a couple sets. If you don't feel like it, that's cool. Eat whatever you want. Don't worry about recovery. Don't take any supplements. What do you think the results would be? They would be crappy. They would be horrible. You wouldn't get results. Does that make sense? So again, recommendations, proper diagnostics and recommendations. We want to guide you from where you are to where we know your potential is, step by step through a proper course of care. So that is really the reason behind why we're going to give you adequate diagnostics, adequate testing, adequate recommendations for you and your family's health.